We can cross over to Madrid now to get the latest from our correspondent in Spain, Sarah Morris. Sarah, break it down for us. What's the latest on COVID-19 in Spain? Are things getting out of hand once again?
There's certainly a great deal of concern, Eve, here because the rate within a month has gone up by 7 times. We had a rate in Spain, across Spain, of about 100 per 100,000 cases of COVID, and that has gone to over 700 per 100,000. There did nevertheless seem to be a slowing of that curve, and what the health officials do stress is that the death rate is nothing like previous waves. Yesterday, the latest figures, 55 deaths in 24 hours. You may remember there were hundreds of deaths per day, virtually 1,000 on the worst day. So the vaccination program does seem to be helping the most vulnerable people stay out of hospital, and if they do, in some small minority of cases, catch the disease, the actual result of catching COVID is not what it used to be. The government says that the fifth wave can be better tackled thanks to that vaccination program, really celebrating the fact that it overtook the United States and even the UK for people in the country who are completely vaccinated. It is the leading country among the 5 most populated nations at 55.5%. Using the University of Oxford data, our world in data, higher than Canada, which is at 55.2%. But nevertheless, as you mentioned, regions are reimposing restrictions because they are particularly concerned about hospitals that are starting to feel the pressure. Again, the occupation for COVID has doubled in the last month. It's now at 16%. And if you look at a region like Catalonia in the northeast of Spain, they are now at 44%. That's particularly concerning. Lots of doctors there are saying surgery in Catalonia is being cancelled, and the region is having to reimpose restrictions. The curfew is already back. The regional government would like to extend it until the 6th of August, and many people say really more measures need to happen to make sure that the 5th wave is not deathly and does not spiral out of control.
Sarah, I'm reading that most of the new cases are in people under 40. I guess that correlates perhaps with the people who are in fact vaccinated.
That's right. The numbers for the 20 to 30-year-olds, they are very, very high indeed, 1,000 per 100,000 cases. In some regions, 1 in 30 young people have COVID, and that's really partly because they haven't been vaccinated, partly because young people, since the lifting of the state of emergency in May, which ended curfews, have been out partying, and some of the health officials say they have been irresponsible. They have been gathering in too large groups. They haven't been wearing masks. That's led to the closure of some nightclubs in some regions, and it's also led regions to start to try to vaccinate the younger age groups, including in cases like Catalonia, getting out mobile vaccination vans where people can drop in if they haven't got an appointment, using the vaccinations for those vital doses for younger age groups, really to stop the spread getting out of control.
Sarah Morris in Madrid, thanks very much indeed for that update.